Hello, my name is Brandon Mancini, a radiation oncologist practicing in Grand Rapids, Michigan, with a specific focus on prostate cancer management. This video is a tutorial for the Decipher Prostate Genomic Metastatic test. As of June 2025, the Decipher Prostate Genomic Metastatic test has been available and is intended for patients whose prostate cancer has spread beyond the primary tumor. The following video is meant to be a tutorial of the new Decipher Prostate Metastatic test report and will provide an overview of each of its sections. You may already be familiar with the Decipher Prostate test used with patients diagnosed with localized prostate cancer. In essence, the Decipher score is determined solely by the genomic characteristics of the tumor. The score ranges from 0 to 1, where a lower score indicates a less aggressive tumor and a higher score indicates a more aggressive tumor. In localized prostate cancer, the score reflects the risk of metastasis and gets classified into 3 Decipher risk groups: low, which is a score of less than 0.45, intermediate, which is a score of 0.45 to 0.60, or high, a score of greater than 0.60. The Decipher score used in the metastatic report is identical to that used in the localized disease setting, in that it is obtained and calculated in the same way with the same specimen requirements. Here too, a lower score indicates a less aggressive tumor, while a higher score indicates a more aggressive tumor. However, in metastatic prostate cancer, the Decipher score reflects the risk of metastatic progression rather than the risk of metastatic potential. Accordingly, the report is designed to provide clinical evidence and risk estimates to guide treatment decisions in patients with advanced prostate cancer, which are different from those in the localized disease setting. In the metastatic setting, the Decipher score is also classified into Decipher risk groups. However, a different predefined cut point of 0.85 is used. So, Decipher scores in these settings are either classified as lower risk, less than or equal to 0.85, or higher risk, greater than 0.85. The 0.85 cutoff reflects the median Decipher score measured across more than 1,200 patients with metastatic castration-sensitive prostate cancer in prospective and retrospective trials. Similarly to how it is used in the localized disease setting, in the metastatic setting, Decipher's higher risk scores indicate that the patient is more likely to benefit from treatment intensification. The information provided in the Decipher Prostate Metastatic test report, which we're about to review, is based on both the Decipher risk group and the disease volume, which means that there are 4 possible scenarios: low volume disease with either lower or higher Decipher score, and high volume disease with either lower or higher Decipher score. The reports for all scenarios have the same structure and sections. In this tutorial, we will guide you through a sample report of one of these scenarios. For demo purposes, we'll be using the following sample report for a patient with low volume disease, which is as defined by the ordering physician, and a higher Decipher score, 0.97 in this case. The first page of the test report, which you see on the screen now, consists of 3 sections. We'll be going through these step by step from top to bottom. The top section on page 1 includes the patient's basic demographic information, specimen details, and the name and address of the ordering physician. Below this information appear the clinical and pathology details, such as the specimen type, whether it was a needle biopsy or radical prostatectomy specimen, the disease volume, as defined by the ordering physician, and the metastatic sites. The number of metastatic lesions will also appear in this section as greater than or equal to 4 or less than or equal to 3, if that information is provided at the time of the order. Next, in the Decipher Genomic Score section, you will find the Decipher risk bar on the left, labeled with the patient's Decipher score. As mentioned earlier, the Decipher score is classified here as one of 2 Decipher genomic risk groups, lower or higher, based on the cut point of 0.85. It is important to mention that the 0.85 cut point, distinguishing the lower and higher risk groups, was selected based on the median score across retrospectively and prospectively tested patients with metastatic castration-sensitive prostate cancer, which ranged from 0.80 to 0.90. Please note that the Decipher score is a continuous variable. So while a patient with a Decipher score of 0.86 and another with 0.97 are both classified as Decipher higher risk, the patient with the 0.97 Decipher score has a more aggressive tumor biology. Adjacent to the Decipher risk bar is the interpretation box, where you'll find key takeaways based on the patient's Decipher risk group from clinical studies of patients with metastatic castration-sensitive prostate cancer. This section also includes the newest evidence from analyses of multiple phase 3 randomized clinical trials. Notably, these studies have shown consistent findings. Those with higher genomic risk are more likely to benefit from more treatment intensification, whereas those with lower genomic risk have similar outcomes with or without the intensification. The bottom section on the first page presents risk estimates specific to this patient. The infographic is visually highlighted based on the patient's Decipher risk group, lower or higher, and disease volume, low or high. For this patient, who has low volume disease and a higher Decipher score, the low volume disease section is illuminated. A red frame highlights this area to indicate the higher Decipher risk. If the patient had a lower Decipher score, this section would instead be outlined in blue. Risk estimates include the likelihood of remaining sensitive to hormone therapies at 18 months and the likelihood of being alive at 3 years. The thing to keep in mind with these percentages is that the higher the percentage, the better the expected outcome for the patient. These were calculated based on data from phase 3 clinical trials and reflect outcomes after treatment with ADT alone. Though ADT alone is no longer considered standard of care for most patients, one way to think about these numbers is that they are a worst-case scenario and may help highlight why intensification may be beneficial to the patient. You'll see in this section that there are 2 boxes of risk estimates, one for patients with low volume disease and one for those with high volume disease. Only the box that matches the patient's actual metastatic volume will be highlighted. The other box, shown in gray, represents what the risk estimates would look like for the same Decipher score if the patient had the opposite disease volume. In this example, the patient has a Decipher score of 0.97 and low volume disease, so the low volume box is highlighted. Right next to it, the grayed out box shows the estimates that would apply if the patient had high volume disease instead. An important point regarding the designation of low or high volume disease in the report is that the risk estimates were calculated based on the definitions used in major trials, such as CHARTED and STAMPEDE. However, we know physicians may apply their own criteria. For that reason, the report highlights the patient's volume of disease as defined by the ordering physician. The second page of the report provides different pieces of information that may be relevant for this patient, which were derived from published analyses of Decipher in phase 3 clinical trials. This page consists of 2 main sections, the therapeutic absolute benefit section and the findings from analyses of phase 3 randomized trials relevant to this patient section. The therapeutic absolute benefit section at the top of page 2 displays the 3-year absolute benefit in overall survival from the addition of abiraterone to ADT, as determined by data from STAMPEDE Arm G, and docetaxel to ADT, as determined by data from CHARTED and STAMPEDE Arm C. An important note about the absolute benefit section. Unlike the risk estimates from page 1, which are unique to each Decipher score, the absolute benefit values on page 2 are fixed. They come from published trial data and are shown by Decipher risk group and disease volume. This means the same values appear on all reports, but the fields that are highlighted will differ depending on the patient's Decipher risk group and disease volume. This patient's disease volume is highlighted with the thicker black frame, and the box within highlights the patient's Decipher risk group. In this example, the patient has low volume disease and is Decipher higher risk. But if the patient were Decipher lower risk, then the blue box would highlight the lower Decipher percentages. Once again, you'll see grayed out boxes next to the highlighted ones. These show the absolute benefit values that would apply if the patient had the opposite disease volume. The bottom section on page 2, findings from analyses of phase 3 randomized trials relevant to this patient, includes clinical findings from post hoc analyses from 5 trials of metastatic castration-sensitive prostate cancer: Titan, Stampede Arms G, C, and E, and Charted, as well as Spartan, which is a trial of patients with non-metastatic castration-resistant prostate cancer. The key takeaways highlighted from these analyses correspond to the patient's Decipher risk category. The third and final page includes the fine print of the report. On page 3, you'll find more information about the test, including the test description, the intended use, the confidence intervals for the risk estimates on page 1, and references used throughout the report. Thank you for your attention during this tutorial for the Decipher Prostate Metastatic Test Report. In my own practice, use of Decipher has allowed for enhanced patient care, facilitating patient-shared decision-making and greater opportunities to personalize a patient's treatment journey. The use of tumor-specific biology to augment clinical, radiographic, and other patient data supports the evolution of personalized medicine, ensuring each and every patient receives the very best care for their unique presentation. Should you have any further questions about the test, please contact the Veracyte Decipher clinical team at decipherclinical@veracyte.com. Thank you.